I'm going to talk to you about something that's called electric muscle stimulation, which I'm sure most of you all have already used it, by the TENS machine. But the TENS machine is a single point plan, and the other one that we use is a whole body EMS. That's Namrata. I've just marked the yellow portion. She's an advanced EMS trainer. And that's me. I am head of the education India, representing Rucker College from Germany. So all trainers who ever want to do whole body EMS, they have to go through me. A little something about what is EMS. EMS has got its origin from physiotherapy, but it stands for electric muscle stimulation. In conventional training, muscles are controlled via the central nervous system, while in EMS training, the muscles react to a stimuli from an externally applied electrode. The muscles cannot determine whether the signals comes from where it comes from. And what happens? They actually reaction with a contraction. So for example, even if it is from your mind, where you're asking your muscles to contract, here you are, you're contracting. And if it is from the machine, your muscles don't know where the electrical current is coming from, whether it's from the brain or from an external source. EMS is a whole body workout. It's a mix of conventional training and EMS both. And it's the only form of exercise where you are activating agonists, antagonists, synergists, and stabilizers. And it has a it has a simultaneous activation of larger muscle groups. It's very time efficient, just 20 minutes per session, maybe done once or twice a week, and it's highly effective. The combination of voluntary contraction and EMS is the key. The reason being, science says that when you have a voluntary contraction, you actually gain 40% better results compared to just standing there like that. It also helps in managing joint issues, improves muscle coordination. It's a great addition for athletes. Any age client can benefit, and it's great for rehabilitation. The oldest known person who is doing EMS is a 90-plus-year-old gentleman in Germany. And why is he doing that? Because he actually has, he's just recovering from a stroke. And his wife is a doctor. So she suggested that he does EMS. And I have the video, which I can always show it to you guys, how he responds to it. So it's pretty magical, and it's backed by science. The reason we have taken low back today is because low back is probably the largest or the most single cause of disability in the world. There are 619 million people globally who are currently having low back issues, and which will go up to 850, I think. Yeah, 850 million by 2050. Non-specific low back problem is the most common presentation of LBP. About 90% of the cases are having low back. Now, how is it? I'm going to just miss this slide. Slide's not really much. It's not very important for you guys. But when they went through an EMS routine for about 6 weeks, these are the kind of results that they saw. These are this is non-specific. Means not necessarily with slip discs, etc., but just the normal low back which the people have, which is almost 80% of the public who go to doctors for low back. So as you can see, the green line, in 6 weeks, almost, I think it was about 30% of people were already better. They had much less pain. And in fact, even medium pain were about another 30%. So it's really a special way of training. Some of the interesting results which have been studied are, one, there's an average increase of plus 21% more power after EMS. On average, plus 11% jumping power after whole body EMS in combination with jump training. And whole body EMS was the only training method that increased the speed of contraction of muscles by up to 40% more speed. No other method showed any significant improvements. I would love to actually meet you all and talk more about EMS because I just have maybe about 30 seconds left. So in case we would like to take this forward, I'd love to talk to you all. We have had Leander Pairs who had a ligament tear, and he still trained with us. We actually put him on a Swiss ball and he did EMS, and he recovered very, very quickly. Some of the other stars who have worked out with us are as marked in yellow. And we just did a little program for the Mumbai Ranji Trophy team. Also, especially for physios, there are programs in Germany where online, which you all can do, and these are some of the programs which is done by my teacher, Jens Wetter. And I'd highly recommend that you have a look at it and see if you all can do it, because it really is special, gives you a lot of insight about how and why back pain is reduced. That's it. We look forward to help you guys, help your patients, and thank you so much.